So a very good afternoon and welcome to this webinar that's being hosted by Nolex and presented by De Montfort University. We're joined today by Professor Katie Laird. She's Head of Infectious Disease Research Group at DMU, and Professor Sarah Uni. She's Professor of Education Innovation, also at De Montfort University. Over the next hour or so, Katie and Sarah are going to be giving us an overview of the interdisciplinary research between psychology, health sciences and education, which has resulted in the co-creation of a Germ's Journey, which is a hand-washing resource-based intervention comprising of books, web games, videos and posters. A Germ's Journey has led to improvements in hand-washing behaviour in children, enhanced knowledge of microorganism transfer in children and vomiting associated with poor hygiene. Now then, if you've got any questions during the webinar, all you've got to do is type them into the chat box to the right of your screen, and at the end of the session, Katie and Sarah will do their very best to answer all of them. And any questions that we don't have time to answer will be forwarded and will be answered by email. So let's get the webinar underway and let's bring in Katie Laird. Katie, good afternoon.
Hi.
And welcome.
Hi.
Hi.
Sarah's
Go ahead.
Lovely. Okay, and I think Sarah's going to join us as well. So there's Sarah. Hi. So as Paul very kindly introduced us, I'm actually a microbiologist and specialise in infection control, along with Sarah, who can now introduce herself.
Hello everyone and welcome, and it's good to have you join us this afternoon. My name is Professor Sarah Uni, and as Paul has said, I'm a Professor of Education Innovation, and I work with Katie Laird on this project, bringing in the element of how we can enhance learning from an educationalist perspective on the project.
So next slide, please. The Germ's Journey come about when basically my children were very young, and we got to the potty training stage, and particularly my son didn't like washing his hands, and so we looked for some I looked for some resources to aid me in hand washing and germ transmission, etc., and they just didn't exist. So from a microbiologist perspective, I knew the message that was needed to be given to children, but I wasn't sure how to do that. And that's when I contacted Sarah, who had the specialities in how do we deliver that message to children in order that they can understand. And Sarah's now going to go through the aims and missions of the project.
So what we wanted to do then was looking very much at toddlers in the first instance, as Katie said, because the resources weren't there. It was how can we look to get this message out more across the sector of the early years settings, whether it be in nurseries or childminders. And we realised that by creating a book, this would enable us to give the resources to both the grown-ups and adults in that setting, as well as the children. So what we did in the book was make sure at the back we had guides for giving hints and tips to adults about how they could ask questions when they're working with the toddlers through the book. Obviously, it's very visual, and that's what we needed to, because that was age appropriate. And as the project has developed over the years, what we've done is develop new resources for different age groups going forward. So then we moved into, for example, early years in school settings and foundation stage and year one. We're also moving into key stage 2, but later on, when we talk about adults living with dementia, we've also wanted to move more into intergenerational resources that we're setting. But as I said, the idea was to share and create resources that could be used at a global level across the world to help engage anyone that is talking or working with children to enhance their understanding of germ transfer.
And the aim and mission of the project was to make this all free at the point of access, so that regardless of where the setting was, that these resources would be available. Okay, next slide, please. We're now going to just play a short video giving a little overview of the project. Okay, next slide, please. Next slide, please.
So what we wanted to do here with the book, as we said, is we're aware that we're working with very young children that can't read yet, but we know that the way to do that is to do it in a very visual manner so that we can have children see clearly the ideas that we're trying to get across. And one of the complexities with germs, which we know as adults, is that actually they're microscopic and you can't see them. But children have very literal and very concrete thinking when they're young. And we know that from child development and from child psychology, that children don't actually start abstract thinking till they're around 10 or 11 years old. So how do you get across an abstract concept that something exists, even if you can't see it? So this is where we came up with the idea of actually using some thermochromatic paint that actually in the book hides the germs. And when you rub the paint, which is a thick black color and you can't see what's under it, the friction and the heat from your hand rubbing actually leads the paint to dissolve and then the germ appears underneath. And this was a innovative little teaching idea that we had to help children understand that, okay, I go to the toilet seat, I might not see them, but they are still there. And in particular, it was understanding the transfer from hands to mouth when eating food. If hands haven't been washed, that then those microbes will get into your gut and make you very poorly. And we have to say that the children's favorite page is that very last image where you can see some projectile vomiting, which the children really like. And obviously, we're getting across the idea that germs can make you sick. So we go to the next slide. So as well as the actual physical production of a book, for which we also receive support from the Society for Microbiology, we also wanted to develop online resources because we're aware that as we are in a digital age, a lot of children will have digital devices. Okay, it won't be phones, but we know that a lot of younger children are having access to tablets or iPads. So by developing the website, we also developed some very straightforward interactive games where the cafe scene there is where children have to find where germs might be hiding. And the idea here was that if they're going out with parents or carers, that they may be used to a situation of sitting on a chair and seeing what is around them that might be hiding places for germs. And they move their cursor over the areas where they think they are. And if they find a germ, they get a little hand clap and the germs magically appear, like in those congratulations emojis that you sometimes get on emails. And it again is a way of engaging the children in the key ideas here around germ transfer. So if we go to the next slide, the other aspect of our work, as well as creating resources, is to actually physically go into schools and run workshops where we actually do some experiments, where we can do the pepper experiment or where you put the glow gel on children's hands so they then go and wash the glow gel off, but then we shine the UV light and they can see actually they haven't got rid of all of them. And these are just activities that can again help teachers, nursery workers, childminders engage children in hands-on learning. And we've also done videos and put those on the website. So you don't actually need the Germs Journey team to come and do that, that you can actually do that in any setting just by following the guides that we've put on the website for adults to follow through any of these learning activities that we've created. Even at the level of colouring in is something that children enjoy and we found to be something that engages them. And when we come onto a book later on, we've worked with a graphic designer and she's also put videos on our website of how to draw the germs, and you can follow what the graphic designer is doing, which again the children enjoy as well. So if we go to the next slide. So we're aware that because we're working with young children who can't necessarily read and write, we need to be working with the adults that are around those children. So we've also created, as well as posters that can be put up in any setting, whether it's, say, the school, nursery, even our work in museums, as visual guides around the Germs Journey messages. We've also created guides for parents, and we've also made sure that where we can, we've translated these into other languages as well. And this we found was very important during COVID when we had international aid agencies contacting us, asking if they could translate these posters at a time when hand washing was being very, very heavily promoted at the start of COVID as a way of coping with the pandemic. And we're pleased to say that we have the template for the posters that we could share with both aid workers and community workers and health workers all around the world. And that's something that we're continuing to do as we go forward. Next slide. So as well as having our website that has all the resources on that anybody can access, and as Katie's already said, is free of point of access, we have also worked much more closely with partner organisations in specific parts of the world. So Katie's already said that when we worked out in the Gujarati region in northern India, we worked with the Andy Gashram, and in particular we went to work in very deprived slum regions of the city so that we could aid people, both the adults, as I said, and the young children, in learning more about germ transfer and understanding the importance of hand washing. And it's not that people don't understand, it's just about highlighting its importance. So we're very clear here that this isn't about being the imperialist white savior that's got all the science knowledge about how to wash your hands. That's not our philosophy. We come very much from a more democratic, co-constructivist approach, whereby when partners approach us, we say we'd like to work with you and your local communities, and we'll create the resources together. So it's that sense of doing it from the grassroots up that means that we can make sure that the language we use, the images, for example, toilets look very, very different in different parts of the world. We made sure that we got both photographic and also cartoon illustrations of what were culturally appropriate uses of toilets, hand washing, access to water. So not all water is as we are used to it in the West. For example, we're looking sometimes at the use of a tap and a bucket outside. When we were working in West Africa, it was literally barrels of water on the streets. So again, we wanted to make sure that we were able to capture and represent in our posters and our resources what different types of water can be available to undertake effective hand washing. So as you can see from the map that we've been working with here, we're wanting to work across all the different UN regions. We've been working in Europe and have worked with Germany and Poland in developing resources. We've also been working with our publisher Medina out in the Middle East, and more recently we've been working out in Sierra Leone in West Africa. So that's an idea of how we're trying to create free global resources that can be used in a variety of different settings by a variety of different people, with the focus always being on working with adults and children together to create joint songs, videos, visual images, and different sets of resources that can be used. And I'll pass on to the next slide, and Katie.
So I'm going to talk to you a little bit more about the actual research that we've done that underpins all the philosophies that Sarah's been describing. So we have worked in a number of schools with the original book. And I think we actually actively worked with nearly 350 children. We did pre and post testing to try and understand what impact these resources, the workshops, the web games were having on understanding within these young children. So we found that children had a 40% increase in germ transfer knowledge. Now this was pre-COVID era. So that was quite a big increase when we're talking about young children here who are unable to read yet or are just beginning to read. So we're talking that early key stage 1. We then went back after a month to see if that knowledge was retained, because it's okay children understanding what we're teaching them whilst we're there, but is this something that they're going to carry on? And it was, there was a 30% increase still after 1 month. So when we were working in India, we were working with children that were illiterate, so the pictures become all the more important, as did the additional resources that are on our website, because they're much more interactive. So we actually spent 3 years going out to India and looking at embedding these resources, but 2 months after participating in these workshops, still 60 to 73% of children knew how germs caused illness, which they didn't prior to this. And more impressively, 80% now knew how to remove the germs from their hands, which was really good. And we also then went back out in 2020, and the biggest impact we had there, that the teachers actually had the resources that enabled them to teach the children, because prior to that they were trying to teach children about germ transfer, transmission, and how this affected their health, but they didn't actively have the resources that they needed. And one of the interesting facts that also come out of this is the children were going back out into their communities and teaching their parents, their grandparents, their aunts, their uncles. So the spread of knowledge was much bigger than we were able to record in that instance. Next slide, please. Now, Paul mentioned at the beginning that we have also got psychologists on the team, and what we wanted to understand was, could we change behaviour as well? So it's okay understanding there's an increased knowledge, but does this then reflect into change in behaviour that then goes on to reduction of illness? So we worked with some psychologists and we worked in schools in the UK, but also, as Sarah's mentioned, is we do have a display in the Think Tank Museum in Birmingham, which has got hand washing posters and this very cool magic mirror that you press and then a song appears and you can follow the actions of how to wash your hands properly, as well as our hand washing songs that we have on our website that are freely available for everybody to access. So we looked at that change in behaviour where we'd implemented a workshop, but also change in behaviour in public spaces where it was quite instant. And what we saw was there was a 23% increase in washing in between the fingers and around the wrists. So most children we were observing when they were washing their hands was what I call the tickle fingers, where they just sort of use the water and tickle their fingers underneath. However, after having engaged with our resources, we were seeing quite significant increases in motions of hand washing that were being missed prior to that. And after a month, when we went back, that the 18% increase was still occurring in those areas. And what was really interesting was that 50% of participants were washing in between fingers compared to 25% of the control group. And for Sarah and I think the public space data we got back was the most impressive for us, because we literally had a couple of minutes to engage with these people, which would be very similar to maybe your healthcare settings where you can't deliver a whole workshop, but you want to have impact quickly. And this is a element of our research that we are going to pick up a bit more. Next slide, please. And for me, one of the biggest moments, I think Sarah as well, was when we were in India. We went back for the third time. 100% of the teachers and healthcare workers that we're working with reported less sickness and diarrhea in the pupils that we're working with that had gone through these workshops. So that was quite a big moment for us. Okay, next slide. Oh, we've skipped one, back one. Thank you. Okay, so we tried to measure reach. We believe, and this is only what we've recorded, there's obviously a lot, the ripple effect that we haven't been able to record, that we've reached over 200,000 people with the resources, and we know we've actively engaged with, it's actually higher than that, 30,000 children now. We've had sponsorship for some big names that have allowed the project to occur, and by using sponsorship as a way to fund the project, it means we can make the resources all freely available. To date, we've donated 6,000 books to 3 countries across 3 continents. So that's we feel we want to build on this. Okay, so next slide, please. During COVID, we're approached by the publishers to develop another book that wasn't just about bacterial disease, really, so that hand toilet, washing your hand transfer, but more about respiratory disease. And that's when we developed Bye Bye Germs. And this was sponsored by Barclays. And as well as developing the book, there's a whole host of resources that you can all access on the website. So we've got a reading by the illustrator of the book that's got cartoons that pop up around it. We've got the Draw the Germ, we've got the lesson plans. So this book particularly is very relevant at the moment, and this is for slightly older children, so you're talking more 7 to 8 years. And what's really important, Sarah's mentioned this, is the scaffolding at the beginning, because we were actually teaching the parents without them realising. So within this, it describes the difference between a bacteria and a virus in very simple language to the parents to help the children, how we can get rid of germs, how germs spread and multiply. And that's been really important in actually educating adults whilst they're working with the children as well, we found during the pandemic. Next slide, please. So something more relevant to the healthcare arena, we have developed the Superstars. This project's been sponsored by Medipal, and this is all about hand washing products that can be used on paediatric wards. So we have clinical trials ethics to undertake some studies, which we're currently doing at the moment. Next slide, please. So basically, they're superheroes, the Superstars, and they're joining forces to clean hands. And we have a number of characters. And we got, as I said, approval for clinical trial in 2020, and those projects are ongoing at the moment. And the team of Superstars is run by King Clean and the Hygiene Queen. We were very, next slide please, we were very aware that when we were developing the characters that they had to appeal to all male, female, and different ethnicities as well. So when the pandemic hit, it interrupted our paediatric clinical trial a little bit, but we had lots of schools contact us saying, can you make some posters that we can put up around the Superstars? So we did those. So you can see Hygiene Queen, Sudley and Evie Squeezy there. And these have been put up in schools during the pandemic. Next slide, please. So the Superstars is like, I want to say McDonald's box, but that's not very healthy, but that kind of concept, the little McDonald's box type, Happy Meal type boxes. And within that, you have got products. So we have got wipes from Swipes, we have hand gel, we have liquid soaps. And if you can go on to the next slide, please. You can see there as well that we have lots of interactive games and colouring things that the children can interact with. So the idea is, as you can see the boxes here, that these are given out on paediatric wards, and we can look at pre and post intervention. Because at the moment, I'll talk a little bit about the actual data we've got from the research, but there's just some plain wipes going out on trays with meals, and the children don't appear to be engaging with these. So next slide, please. So it's really important when we were developing the games and things that were going out in these boxes that we were able to teach children some of the germ transfer here. So if you look at the squiggly diagram that most of this page consists of, this is a decision-making tool for children. So we're talking children most probably from 5 to 10, 11, and they have to make a decision on when to wash their hands and when the important times are to wash their hands, and follow the trail through until they get the cupcakes at the end. Next slide, please. We've also got here a word search, but most importantly at the top is a bit of maths work so that children can understand how bacteria multiply and how quickly they can multiply, which is really important in understanding when the germs get into their stomachs, what's happening and on surfaces, and why we need to wash our hands. As well, they've got create their own Superstar character there as well. Next slide, please. The other thing that's really important, it comes back to the behaviour studies we did, is that children are notoriously bad at actually reaching all of their hands. I'll say to my children, have you washed your hands? And they'll say yes, and I've looked at them where they've literally dipped their fingers under the water. And so we felt it was important to give some knowledge to children as well, how they should be correctly washing their hands. And all of this can be delivered with their meals. on the paediatric wards, and they can work through these boxes and use the products without having to leave the bedside. And that was really important when we were designing this for paediatric wards. Next slide, please. So the NHS study then, it basically aims to look at the effectiveness of this intervention. But what's really important is we want to look at what's happening now without the intervention. What happens if you just give the children the products but not the educational resources? Is their engagement increased once they understand the educational resources, how they multiply, germs multiply, when they should be washing their hands, how they should be washing their hands? And so it's a three-part intervention, really. So we're observing the children's engagement with them, and we're working with staff on brief questionnaires and interviews to understand how they think it's aided children in increasing their hand washing knowledge and behaviour. Next slide, please. So to date, we've conducted the study in 4 schools and 2 hospitals, and we've got another 3 hospitals taking place over the coming months. Observation we've made is the housekeepers are absolutely key into delivering this intervention and actually in encouraging children to wash their hands, because obviously the clinical staff, the nurses, they're busy doing their medical duties, whereas the housekeepers are in charge of that food collection of the trays, etc. So we found that actually they're the key people to get increased hand washing in the children. On for the 2 hospitals we used, we only noted 2 to 3 parents that were actually encouraging the children to use the wipes on the trays, and the housekeepers were reporting that 80 to 90% of those wipes were coming back unused, which was really interesting because it's just a plain packet with a little wipe in. Many times they were just under the plate and not used, which was some interesting data. And what we have seen, the preliminary data is showing a definite increased engagement with the products and washing of hands prior to meal times when these interventions are being delivered. And I must say the children's faces light up when they see the little boxes and they're interested in the information that's in them and engaging with them. So one of the initial findings from the healthcare staff questionnaires was that the parents need to be engaged as well, and that they felt they were a barrier or enabler to actually the children washing their hands prior to eating. But as I said, the data collection is ongoing on this study. Next slide, please. Some of the barriers that we found was there was quite a lot of exclusion criteria. So nil by mouth, children couldn't be involved, children under 3 because of the safety of the products. We didn't observe those children that had eating disorders, and anyone with a highly infectious disease. We obviously didn't go into the rooms and observe them either. In one of the hospitals, we had significant language barriers, and Sarah has spoken as well about how we can develop these resources so that they're in a number of different languages, and also the images more relatable too. This may overcome this issue. And we were finding there was quite quick discharge of patients, which was great for them. But in terms of the study, obviously we wanted to observe for slightly longer. Next slide, please. So now I'm going to hand over to Sarah to talk about our dementia, resources for those living with dementia.
Great, thank you. And we will take the questions and answers at the end, and just keeping an eye on what issues are coming up around access to the resources. Yes, everyone who's here today and listening, you will have complete and access to all the resources that are free for you to use in your different settings. And with Paul at the end, we'll systematically go through your questions. But just to reassure you all that what Katie and I want to do with you today is give you like a little thumbnail sketch of what each of the resources are and what they do, and to give you a context for how they could be used. And just to reiterate, it's whatever resource will work for you in your setting with your target audience and the adults that are around that target audience. So we did find that one of the most effective things we did was an action rhyming song that was a step-by-step guide to washing hands that had a little nice catchy tune that went with it, and then the actions that went with washing the hands. And that was so quick and easy to see visually and listen to, that was one of the things that we found really, really had a major impact, as Katie said, to leading to making sure they're washing between their fingers and round their wrists, for example. And what we realized that as we've been working with children and adults is that there are also those adults that are living with dementia who, as we experience dementia, either watching close relatives or we know of people living with dementia, is that it's really important to keep up social interactions with those around them, and also to keep up familial family ties. And we wanted then to focus on a book that could be used by anyone living with dementia to both work as a way of reminding them around how to effectively wash hands, the reasons for washing hands. So coming back to the infection prevention and germ transfer science knowledge, but also to have a book that they could use either with their own families or their own grandchildren. So to do this, and this was very much supported by our publisher Medina, because they're based in the Isle of Wight, and we know from the demographics of the Isle of Wight that there's a disproportionate number of elderly living on the island, and that there are a number of care homes, and that our publisher was very keen that we started to look at how could we adapt the resources we've got so that they are suitable for people living with dementia. Now, Katie and I have wanted to do this, and the project has our full support to do this, but we also know that we needed to bring on board now a specialised nurse in this field. And to this end, we have a colleague called Dr. Chris Nifton, and he is both an Admiral nurse. He's previously also run a care home, and he's now an associate professor in the Health and Life Sciences faculty, and he teaches on our nursing and midwifery courses, specialising in modules on supporting those living with dementia. And we approached Chris and said, Chris, we have all these resources that we have for children. Can you work with us to readapt these so that they are dementia friendly? And that's what we then did as another aspect of the project. So next slide. The first thing that we want to do, which is part of our philosophy of co-construction, is to make sure that we actually worked with a group of people that were living with dementia alongside other adults that were working in a close relationship with the people with dementia as well. And I don't want to say elderly people, because dementia, you can have early onset dementia at any age. And it can occur, as we know, it's non-discriminate. Anyone of us can get it. It's particularly poignant to me, as one of my parents has dementia and has an Alzheimer's diagnosis. So we wanted to work alongside the adults to say, this is what we did. And you can already see from this version that we've created, the front cover is very, very different to the one for children. You can see that the picture is different, and you can also see the words and the language we have used is different. So, for example, it says wash the microbes away. It's a different type of language. And the reason we wanted to do this is because we knew the book had to be relevant to those that are living with dementia. And to this end, we worked with a focus group. And the focus group were working with Trent Dementia and a dementia specialist nurse. We ran the focus group. We went through the original book and we asked them, does the text in here work for you? If not, why not? What words should we use instead? And also, were the images right? Was there anything that was not appropriate? And I have to say that we were actually very surprised by that focus group workshop, because the dementia adults were telling us things that I would never have thought of, and neither would the other people that were working on the book with us have thought of, particularly including the graphic illustrator. So that was a really, really interesting piece of research, and we were going to say more about this when we are speaking at the NOLEX Dementia care homes conference that will be at the National Conference Centre in Birmingham on the 20th of September. But I just wanted to give a flavour of it to you now so that you can understand how we've developed these resources accordingly, even down to the thickness of the paper and the size of the book. So next slide, please. This is an example of the number of books that we have donated with the support of Barclays, who wanted to sponsor the book. We've given the book to a range of different care providers, particularly those that are working in dementia settings. Next slide. So we know that, as we've said, those living with dementia, it's important to keep up the familial ties, to make sure that children are still part of their lives if they have grandchildren, or they may have nieces or nephews. We are aware that there is a policy drive within the sector called the intergenerational policy, whereby the idea is that older people living in a care home setting and or with dementia continue to build relationships with the young people in their familiar settings. We wanted to have this book to actually help that. So it was a focus for when the person living with dementia has the child visit, they're actually able to use the book as a prompt to sit down and talk with them. And again, bearing in mind that the language for this book has been changed to be more appropriate for those living with dementia. So instead of calling it funky facts that we did for the children, the dementia adults said, no, this is about science and we want you to call it the key facts instead. So we're also reiterating key facts around germ transfer as well, and how and why it's important to still continue with good hand hygiene. And the notion of intergenerational policy is really pertinent because with the shutdown and lockdowns that we all experienced during the pandemic, it's taken a long time for care homes to open up again and for children to start coming back into care home settings. So we're hoping that this is also a timely resource that can help re-establish those relationships and those familiar visits. Next slide. Thank you. So we've also undertaken policy discussions with policy advisors in the different home countries with a view to seeing if the book can support intergenerational policies. And when we were speaking with the officers at the Scottish Government, they thought that the book could act as a prompt for those interactions between the generations. We also have worked with a care home group leader that thinks that the idea is really important as a way of engaging not just children, but it can be young people too, with speaking with those in care home settings. We've also worked with Wakefield Council that think, as I've said just now, that post-COVID era of returning to hopefully more frequent visits and opening up care homes again, whilst still reiterating the importance of hand washing. And we've started also discussions with Public Health Wales around how the book can be used as well. So we just wanted to include some quotes there that we've got from our research so far, and to say that this research is ongoing. So if anybody is interested in, as I said, discussing this further, we'll be in person at the Birmingham conference on the 20th of September, and you can come and speak to us as well face to face then, as well as any questions now in the chat window. So if we move to the next slide. As I've said, we will be undertaking further research. We're continuing to work with Chris Nifton as the dementia. He doesn't like the term expert because he says the people that are experts in dementia are the people that have it. That's true. But what we are understanding by working with Chris in his role as an Admiral nurse is how we can be more sensitive around working with people that are living with dementia. As I said, also from my own personal experience of my father, for me to have an understanding of working with someone who has dementia and ways in which we can do that sympathetically and sensitively as well. We will be inviting everyone on this call to become involved in this research. We would like to send out questionnaires to healthcare workers and home care managers to look at the book and to see if it can be of use to them and how it might help with intergenerational policies as well. Next slide. So You're welcome to come and meet us in person, as we've said, in Birmingham. You're also welcome to get in touch with us via the slide, as it says here, on our website and through our email, and to also access the website for all the resources that are freely available there as well. And on that note, because we're now coming to the last slide, we'd like to say thank you for listening to us today, and we'll hand over to Paul to look at guiding us through the Q&A aspect of the webinar now.
Thank you very much, ladies. Very, very good presentation, I must admit. And just for anybody that's interested, the webinar has been recorded and can be watched again at your leisure. All you've got to do is go to www.nolex.co.uk and go to webinars. So if you've missed any of it, you came in a little bit late and you want to see the rest and you want to see the slides, then it will be on the Nolex website. Not so very long after the webinar is finished. So let's go through a couple of the questions. We've got one from Chaka Khan in Manchester University. Wants to know, is the book available online?
There's well, it depends which book that you're referring to. The Bye Bye Germs one, there's a reading of it online that's available. All of the books are available to purchase, but we also have some available if people contact us and they're needed within certain settings, then we can donate some books as well.
Brilliant. Grace Grange has said, have you worked with UKHSA's eBugs initiative on this project at all?
We've had conversations with them. So we have had conversations with them about the project. What I would say is eBugs project is quite PDF heavy and not necessarily the donation of books, etc. So our approach was a little different, and Sarah might be able to elaborate on that.
I think that eBug is great and we are complementary. They work in a particular way, and I think that we work in a way that complements and supplements that, because we're very much around experiential learning and very hands-on and co-constructing the resources with those that we're working with. So it's very different from the detailed PDFs that they create. So I think it's just a different kind of pedagogical approach really to teaching and learning. But what we would hope is that any stakeholder or partner would draw from both, because as I said, they complement one another.
Nicola Barlow from the Barnsley Hospital NHS Foundation Trust. Could these be supplied on neonatal units for when siblings visits in order to promote better hand washing prior to touching preterm babies?
Absolutely, we would welcome that. First, in terms of the website, you're welcome to print out any of the posters that are there. They're free to download and they're free to print. And we know that printing posters is affordable and it doesn't cost very much, so we can do that within tight budgets. And again, any resource that is put up and out for children to engage with, particularly if they are visiting neonatal units, that they might get bored as well. So if you wanted a selection of the resources in terms of the books as well, they could be around for children to look at as well and engage with whilst they're with the parents in the neonatal units. So please go to the website and please avail yourself of any resources that you feel would be pertinent to use in that setting.
And in addition to that, MediPal have donated 10,000 of the Superstars boxes to the project. So obviously some of those are being used for the actual clinical trials, but there is boxes that if you felt that some would be useful on your ward, you could contact us as well, and we can work with MediPal to get some of those sent out.
Brilliant. You've got a lot of support for the project here, and one in particular I'll read out from Emma Dawson. It says she works for Lancashire County Council in infection prevention and control and currently holds hand hygiene in primary schools and a building to work with nursery settings. Would they be able to have access to all the resource books, etc.? And would they be able to publish them on their webpage and promote Germ's journey?
Absolutely.
Yes.
I knew you were going to say that.
That's what they're there for. Yes.
Yeah. And hopefully we're hoping that we will have some more sponsorship in the near future for more books as well, to donate more widely. So please do Paul's got our email, so if you need to be put in contact directly, then we can talk to you about what options are best for you.
So can I ask you, how long has Germ's journey been going on? When did you first start? I know we talked about it, probably longer than that, Katie. But I mean, how long's it been actually going, and how impressed have you been with the take up of it?
I think the first book was published in 2017, so I think 16, 17, and we've been working on it for about a year prior to that. It's completely snowballed. I think Sarah and I could never imagined that this idea of, oh, let's create a book for children, and we used one of the art students from the university to do a little project on it. We never dreamt that it would be, I think, as big as it's come, and also for us that it's helped as many people as it has. For instance, the website's been accessed in 117 different countries. So we know it's being used, which I don't think we foresaw how big it would become, nor how much work. Do you agree, Sarah?
Yes, definitely. And what's
But
helped?
I think, sorry, Sarah, go on.
What Katie and I have done is to have, as we use the co-construction model, and as Katie said, we've used De Montfort University students that are doing like a graphics art degree to give them opportunities. When we've gone out to India, we've taken students with us from all types of different degrees, on whether they're nursing or doing photography. We've got one of our students who is actually doing a media studies, and he came and did the photographs for us. So it's always about opening doors up to young people and students to give them opportunities. And Katie and I have made sure that our research assistants are those that are doing doctoral research with us. So we have microbiologists working on the project. We also have educationists working on the project, looking at different aspects around social media and health communication, comms. And it's a project that we hope is something that is for the greater good and is both freely available as a set of resources, but also gives opportunities to those that are helping build it as we go forward as well.
I suppose as well, going back to your answer there about how quickly this has grown, I suppose that shows the awareness now that's there from people are now more aware of the need for hand hygiene.
Yeah, COVID helped sort of promote the need for it and the understanding. And I think the educational messages that were coming out for COVID were quite one-dimensional at times. And I think something that we've found through our research is that one message doesn't fit all. And we've tried to address that with some of the resources we've created. And I think what's really key is sometimes people come up to us with their nurses or teachers and say, we think it's brilliant, but I really hope you don't mind us don't telling it, but I think it would work better in this way. And I think the fact that we're open to say, actually, if that's what you think, how can we work with you, and we'll change it and adapt it in order to have the most impact, in a way, I think has been part of its success.
Absolutely. Our philosophy is tell us what works for you, because it's you in your setting that has the most knowledge about what will be an effective and impactful way of that communication. It's certainly not us. And that's why we like to work very closely with stakeholders to develop this going forward. And the resources are there for you to adapt as well. Please don't feel that, we're at all precious around it. For us, it's more important that the messages around germ transfer are communicated. That's the most important thing for us.
Lisa Manthorpe from Hull University Teaching Hospital wants to know, are the books wipeable stroke cleanable?
Yes, they're not completely waterproof. They wouldn't survive a shower. They wouldn't be survived being let out in the rain. But if you get something on them, you can certainly wipe it off, and it's got some durability. The early years book had to be done on quite thick cardboard, because we know from little toddlers books get really damaged. So we made sure that they are pretty robust. Whereas the other books for those living with dementia are more paper based, but they've got quite a glossy feel to them, the finish, so they can be wiped. So within reason, yes.
Right, well, I think we've got through most of the questions. If I I've missed any out. Anything thoughts, Sarah, Katie?
Oh, sorry, you broke up at the end there, Paul. We didn't catch you. We said.
Sorry, I've got through most of the questions. I think if I've missed out any, we will get to them. But have you got any final thoughts on your presentation today?
But somebody just asked a question about getting sent a sample. So just to reiterate, all the resources are available on the website, and those resources can either be printed out and used directly by people right here, right now, this afternoon, if you want to do that. If you've got a colour printer, you're good to go. The books are all available either through a company who I won't name that begins with A. It's not my job to advertise them, but also direct from our publisher, Medina. And as Katie said, we've got some samples of some of the books that we can give out as a part of a small donation. And if you want to have any donated, then you'd need to email us directly so we can then get back to you and let you know what we've got left on our shelves this end to post to you. Does that answer that question? I hope so.
Yeah, yeah, it does.
And I think thank you for everyone coming to listen, because I can see there's quite a few people, and hopefully the resources will be useful.
Someone said to use the pack as an award.
As an award, yeah.
Absolutely. I'm assuming you mean like a prize or something.
Yes,
I think
so, yeah.
And I think someone else I saw pop up said something about handing the boxes out prior to the meal times. Yes, that is what we were doing on the paediatric wards. The wipes that are currently being used are being given out with the trays of food. But when we're implementing the superstars on the paediatric wards, we are given, when we give the educational box as a whole, so the last intervention, they're given that an hour or so prior to their meal so that they can take that knowledge in and then hopefully apply it when their meal comes and use the products at that point. So I don't know who sent it, but I did see that pop up.
Yeah, so just to reiterate what Katie's saying is that the hospitals we've worked in, they supply wipes when the food is given out that are in a sealed packet, and that was already standard practice. But what the housekeepers were saying was that those unopened wipes get returned with the trays. So we then come in with our set of products around the superstars, and then we're looking at the intervention in relation to that. And we're hoping, as that data is coming in, because we've still got hospital visits to do, that will be published in due course and that we'll be able to share that data hopefully with Paul and Nolex going forward.
Absolutely excellent. Well, we're rapidly running out of time, so
Yeah.
I've got to say a very big thank you to the two of you for taking time out. I know you're very, very busy. Don't forget, as Sarah mentioned before, both Sarah, Katie will be at Care Home 22 Beyond COVID. It's the conference and exhibition at the NCC, that's the National Conference Centre in Birmingham on the 20th of September. We still have some funded places available if you want to that conference. All you have to do is get in touch with delegates@nolex.co.uk and talk to my delegation team there. We've got some funded, which means free places available. As I said, Katie and Sarah will be there with Chris as well, and they'll be enlightening a little bit more on what they've done today. So once again, thank you for joining us. Thank you, ladies. It's been a pleasure speaking to you again, and judging by that, you'll get more support in the coming weeks.
Thank you.
Great, thank you. Thanks everyone for coming today. Thank you.
Bye-bye.
Bye-bye.